Hello, everyone. Dr. Spinach back with the brand new episode of How to Read a Chest X-ray. So I'm quite sure that your neighbors, your relatives, and even your family members must be quite bugging you with a few radiographic pictures of X-ray, CT scan, or MRI even. So you must be really confused. So as to what's the problem with this person. This video is going to make it certainly easy for you to read a chest x-ray. In order to know what the pathology in a chest x-ray is, we should know what a normal chest radiograph looks like, right? And in order to see what a normal radiograph looks like, we should be knowing what are the prerequisites of a chest x-ray. So the first one is that chest x-ray should always be done in a PA view. Well, PA view means posterior anterior view. Now, you may ask, what is posterior anterior view? That I'll come to that in a bit. Just give me a minute for that. Posterior anterior view. Right. And the second prerequisite is the person should be standing, that is, that person should be in an erect position. So we don't want a person to lie down or turn to one side or the other. We just want that person to be in an erect position. And the third thing is the chest x-ray PA view is always done in a suspended and inspiration. That means you have to ask this person to hold his breath after taking, a breath in, and you have to ask this person to hold the breath. So we have to ask them to take this x-ray in a suspended and inspiration. Now, you might ask why. Well, I'm here to clear your doubts on each and every of these questions. So just remember these three prerequisites. So ever, if a person or a patient comes to you for a chest x-ray, it's important that you ask them that, please take a deep breath and hold it for a minute or just for 30 seconds until I take an x-ray of your chest. So it's important. So we'll come to that. Why is it important? First, let's see how you have to ask this person to stand and why this is known as PA view and not AP view. Well, you can see here I have drawn a diagram of a projector that's gonna project x-ray beams onto the person. Now this is a photographic plate, you can see here. So this is a photographic plate and the person has to face the photographic plate. So and the x-ray beams will be projected from the projector towards the back of the person, and this image will be created on this photographic plate. So since this is the x-ray beams are moving from posterior to anterior, and that is why this type of x-ray is known as chest x-ray PA view. So remember, whenever a person comes with coughing and shortness of breath and symptoms like that, and you might want to do a chest x-ray of this person, so you have to write that do a chest x-ray PA view in the advice, diagnostic procedures that need to be carried out in a patient. Okay, so let's move forward as to why did I say that this person has to be in suspended and inspiration. And in that I mean is, well, if you can see, this is a normal chest x-ray of a normal lung. Well, if you can appreciate, well, I have already come to the border, so we are going to discuss markings of a chest x-ray, of a normal chest x-ray. But let me just tell you first that what happens during inspiration. Well, I'm sure you all are familiar with this is diaphragm. With this marking, this is diaphragm. Well, when you inspire, diaphragm moves down. And when diaphragm moves down, well, more lung is filled more air is filled in the lungs. And when more air is filled in the lungs, it's easy to find a pathology that of a lung, that the pathology that a lung might be having, like for example, consolidation or tumor. So that's why we ask the patients to take a deep breath so that their lung is filled with more air, so that we can find the areas where air isn't filled. I hope that makes sense, um, because if you go and see the patient with in an expiration phase, well, like in expiration phase, this dome of diaphragm will be moved more upwards, and when it's moved more upwards, well, this area of the lung will be obscured, and when if you can't see this area, it's difficult for you to identify what's the problem without having a view of complete X-ray of the lung. Okay, so I hope that makes sense. Okay, let's move forward with the markings of the chest X-ray. Well, this is the favorite part for me because, well, this is the place where we, as undergraduates and postgraduates, even and practicing junior doctors get confused. So, well, if you're a healthcare professional, and you should definitely learn to read the X-rays, because it's a very common modality that's usually asked to the patients to do. Anyway, so let's move forward. If you can appreciate, I just want to ask you the first question that, seeing this chest X-ray, what do you think? Is it a male or a female? So I'm sure you can appreciate that there's a shadow of the breasts. So this is definitely a chest X-ray of female. So, and I have already told you, well, this shadow over here, this shadow indicates diaphragm. Well, let's zoom this a little bit, and let's appreciate the other borders here. Well, so the first border, you can see the white and black areas all over. You can see, the opacities, the white opacities here, which are actually the bones. So I'll come to them later. And let's first appreciate this curve over here. Well, if you can see this curve is known as aortic knuckle. Well, aortic knuckle is formed due to arch of aorta that arises from left ventricle. So from left ventricle, the arch of aorta, the ascending aorta arises, and then it forms an arch over here. So this is the arch of aorta that forms the knuckle over here. Okay, well, this over here is formed due to pulmonary trunk. Well, this represents pulmonary trunk, and when I say pulmonary trunk, the first thing that comes to your mind is this is what is originating from right ventricle. That means this is the pulmonary artery. Well, if you can, mildly appreciate, this part over here. See, you can find a curve here. So it's not very much visible, but I'm trying to make it visible. And this is formed because of left atrial appendage. You might be wondering what left atrial appendage is. Well, let me just make this easy for you. When you talk about both right and left atrium, it looks something like this, but we usually forget to, count in the two beautiful appendages which are present just at the corners where right atrium and left atrium meet the respective ventricles. So it's like an outpouching in the muscular wall, and it's present on both the sides, and this is known as appendage. If it's on the left side, it's left atrial appendage. If it's on the right side, it's right atrial appendage. Okay, so you can see this border over here is formed by left atrial appendage. The next one in line is, you can appreciate a sharp border over here. Well, it's this is our own left ventricle. So this is formed by left ventricle. Now, let's move towards the right lung. So I must have told this to you before. Well, the right side towards the viewer represents the left lung of the patient, and the opposite is true with the right lung. And well, worry not, folks. Right lung is very easy to remember. That's because right lung forms the very basic right lung just forms the right part of the heart. So what do you think is present in the right side of the heart? Well, of course, we have right atrium here, and you might be wondering, why is it not right ventricle, because the other side is left ventricle? That's because heart is not present, just like this in the mediastinum or mediastinal space. It's actually tilted a little bit like this. So when you see you have lungs on both sides of the heart, so this is, let's say, left lung, and this is the right lung. You can find that left lung, left ventricle forms the border of the left lung, and right atrium forms the medial border of the right lung. So that's why you and left and right ventricle is actually present anteriorly. So right ventricle doesn't contribute to any borders of the lung, and that is why this border represents right atrium rather than right ventricle. Now, if you can move forward over here. So this is actually the shadow of superior vena cava that arises from right atrium. And moving down over here, well, this is actually the shadow of inferior vena cava, which is not, I'm surely saying this is not very easily identifiable. So, but just giving you an overview of what actually is present all over. So these are the normal markings of a chest X-ray. And if there is something abnormal and you don't see perhaps an aortic knuckle very sharply like this, so you must think of an etiology, a cause of it, a pathology of it, right? Now let's move forward with some of the other things that are present in an X-ray. For example, ribs. Now, how do you know how many ribs do you see in a chest X-ray? Well, you might be surprised with this, but we have a certain number of ribs that need to be seen in a chest X-ray, and if they are not seen, if less number of ribs are seen, then this chest X-ray probably is not a good one, and it's not taken in an inspiratory position, but rather in an expiratory phase of breathing. So how do you know like which rib is anterior and which rib is posterior? So first you should know from where the rib arises. If you can find, this is the vertebra, the thoracic vertebra, and well, if you remember, the ribs actually arise from posteriorly from vertebra, and then they come out in the front, and then they're just like that lying over there, and then there is the costal cartilage that fuses these ribs to sternum. So here the sternum will be located, and these ribs will be fused to sternum using the costal cartilage, and that is the reason why that's quite a reason why the anterior ribs are not complete and posterior ribs are complete. Well, because anterior ribs are ending here, that's because of the costal cartilage, and costal cartilage is a soft tissue. Well, soft tissue can't be as dense as a bone, and hence it's not very well visible over here. So, well, this in this way you can say that, very easily say that this actually, the big one over here that's starting from the middle onwards, that this over here is actually the posterior rib, and when this posterior rib takes turn over here, well, it ends here. So this direction is actually the anterior rib, and this direction is actually the posterior rib. Just zooming a little bit over this side, we have this as posterior rib, and when posterior rib comes along, takes a turn, and it ends over here. So this is the anterior part of the posterior rib. So this direction is posterior rib, and this direction is anterior rib. Okay, I really hope that helped you with identifying the anterior and posterior part of the ribs. Well, let's now count how many ribs are present in this normal chest radiograph. Okay, so if you can see, the first rib over here, the second one over here, then we have third, fourth, and these we are counting the posterior ribs, 7, 8, 9, 10. Well, if you can, a little bit of 11, but 11 is not really visible anyways. On the other side, if you see, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, somewhere here 10. So we can easily see 10 ribs on both the sides. I must have counted wrongly over here. It's 10 here. And if you can appreciate the interior ribs, so it starts from here, 1, 2, 3, 4, 5, 6, 7, and it's similar on the right side, 1, 2, 3, 4, 5, 6, 7. So, well, that means that in a normal chest x-ray, you need to have at least 10, you should be able to see at least 10 posterior ribs and at least 6 anterior ribs. If you see more, then it's okay. That means this person is in good inspiratory phase. But if you see less, that means this chest x-ray hasn't been taken rightly. Okay, so these are the ribs that are seen in a normal chest x-ray. Now, moving forward, there's just one more concept, that's cardiothoracic ratio. Well, cardiothoracic ratio is actually calculated using, drawing an imaginary line towards the right and left borders of the lung to the medial side, and taking the transverse diameter of this part, and also the right and left borders of the thoracic cavity and taking the transverse diameter of this side. So if you can see, this is cardiac diameter, transverse diameter, and this is thoracic cavity transverse diameter. So cardiothoracic ratio is, dividing cardiac transverse diameter to thoracic transverse diameter, and a normal cardiac thoracic ratio should be less than 0.5. So in a PA view of chest x-ray. So if it is more than 0.55, then you must consider this as cardiomegaly. It's an abnormality which is related to the enlargement of the heart. So, because in this case, cardiac ratio increases, that means there is some abnormality related with heart, and heart has increased in its size. Yeah, so that concludes our section for how you read a chest x-ray. I hope you liked it, and if you did, please give it a thumbs up, and subscribe to my channel. Do click on the notification bell down below, and also leave a comment if you liked it. Okay, well, have a great day, and I'll see you in the next episode. Bye bye, take care.